getting checked. Most recommendations recommend African American men at the age of 40. White men at the age of 55. 40 for us because of the higher incidence of prostate cancer and the higher chances of us dying from prostate cancer. The recommendation, as I earlier mentioned, blood test and the rectal examination. Now, a biopsy is when an ultrasound probe is very carefully inserted into the rectum. The prostate is measured, and several pieces of tissue are taken from the prostate to determine if there is cancer in the specimen. If there is cancer in the prostate gland, then the next concern is whether the cancer is just within the prostate or whether it has spread. Now, there are several stages of prostate cancer that are shown there. Stage 1 of prostate cancer is present, but we can't feel it on the rectal examination. So the only way that we know that cancer is present is by the PSA test. Stage 2, cancer is present, but we now can feel it on the rectal examination. Stage 1 and stage 2 of prostate cancer are early stages of prostate cancer. That's when cancer is curable. Stage 3, cancer is present, but it has just begun to spread outside of the prostate gland. Okay? And stage 4 is when it has not only spread outside of the prostate gland, but it has also begun to spread distantly to the rectum, to the bone, to the brain, to the lung, lymph nodes around your neck, etc. One option that's become much more common these days is what's called active surveillance. Active surveillance means, yes, I know I have prostate cancer, but based upon all of the tests that I've taken, it appears that my cancer is slow growing. And if it's slow growing, then I have time to watch it. Okay? Surgery. The most common way in which we do prostate cancer surgery these days is using a robot. So it's robotic surgery. Radiation, there are various forms of radiation that one can use, and you have to talk with your radiation doctor to determine which form is most common in your area. Active surveillance means that every 3 to 6 months, I'm getting a blood test, checking my PSA. And as long as my PSA stays stable, then we can continue to watch it. Every year, you should get a biopsy just to make sure that there has not been any progression of the prostate cancer. In the prostate, we're feeling for nodules, we're feeling for consistency, and we're feeling for symmetry. And if there is any abnormality in any of those, then that's a sign to us that we should do further testing.
I can't understand what you're saying. Because in 2021, I had a PSA level of 2.99. 2023, it went up to 7.76. I have done my second biopsy in the past 3 years. Up until yesterday, up until the big day, I was petrified.
Amen.
I was petrified.
I know.
I was busted. Because I didn't know what was going to happen. Found out my grandfather had passed from it, and it ran in my family. Just by the work I do, I never thought that I would be taken out by cancer. But I got the call yesterday before the picnic. They say I was negative, so.
He said he doesn't have insurance. What do? We do a health initiative every year, and we have a physician there that does the PSA, or he can do the other exam for you too. So just FYI, that's one of the reasons we do this initiative, because we're to make